doctor, and welcome to our channel Healthy Gyan. Today we'll be talking about monsoon related illness among kids. So you tell us, what are the illness among kids?
So in monsoon, there are certain diseases which are seen in increased frequency, such as dengue, malaria, viral hepatitis, typhoid, and diarrhea.
Can you just elaborate each disease by telling?
So dengue, malaria, these are the mosquito-borne diseases. Now in kids especially, this disease sometimes becomes more severe because kids are not able to express the symptoms, or there is a delay in the diagnosis. So these are mosquito-borne illnesses. Anytime you feel your child is having a fever without symptoms, so like there is no cough, cold, there are not any other symptoms with fever, please show your kid to a pediatrician and get the child tested for dengue or malaria after the advice, and don't treat them at home for 2 to 3 days, as usually is done by parents. They try to give some fever medicine or something for 2-3 days, and after that they take them to a doctor.
What precautions should one take at home to avoid dengue, malaria?
So these are mosquito-borne illnesses. So we have to prevent a mosquito bite. You can use mosquito nets at home. You can use mosquito repellents. So there are certain creams available, certain sprays available which you can use. So that's the best way to prevent biting a mosquito. Sometimes dengue can complicate and they go into shock. So there are certain signs of dengue getting complicated. So pain in abdomen, vomiting, cold hands and feet, bleeding from any side, say nose bleeding or bleeding in the skin, we call it petechiae. These are signs of symptoms of dengue going into shock. We call it dengue shock syndrome. In malaria, there is a fever which comes every 24 hours, 48 hours. Fever is along with chill and very high grade fever. You can have headache along with that. Very sometimes you can have a jaundice or a convulsion also in a malaria.
Can you suggest something our viewers are seeing?
Diarrhea, hepatitis, typhoid fever, these are waterborne illnesses. So infection spreads to water, contaminated water or food. Use boiled water, don't eat food from outside, and there are certain diseases which are vaccine preventable, such as rotavirus, diarrhea, hepatitis A. So you can take vaccine for the same from your pediatrician.
Okay. Thank you so much, doctor, for talking with us on Healthy Gyan.
Thank you.